Hi everyone, welcome back to another lesson. This lesson is on urinary tract infections. So we're going to talk about what causes urinary tract infections. We're also going to talk about the signs and symptoms, how they're diagnosed, and how they're treated in this lesson. So let's talk about what a urinary tract infection is. It is majority of the time a bacterial infection of the urinary tract, and we call it a UTI. So here is the urinary tract, here is the kidneys, the ureters that lead down to the bladder, and then the urine goes out through the urethra. And what happens is bacteria can enter into the urethra, climb the urethra, and get into the bladder, causing an infection of the bladder, or what we call cystitis. This is a common, simple urinary tract infection. And in some cases, the bacteria can climb up the ureters and even get to the kidneys, where this would be called an ascending urinary tract infection. And that infection of the kidney is something we call pyelonephritis. So again, majority of the time, it's going to be a simple urinary tract infection that affects the lower portions of the urinary tract, so the bladder. There are some cases where organisms may colonize the urinary tract but cause no symptoms, and this is what we call asymptomatic bacteriuria. So some patients or some individuals have bacteria in their bladder or their urine, but there's no infection. And in this case, we would not call this a urinary tract infection, we would call it asymptomatic bacteriuria. And as we mentioned before, an ascending urinary tract infection can infect the kidneys, causing pyelonephritis. If you want more information on pyelonephritis, please check out my full lesson on that topic. What is the epidemiology of urinary tract infections? Females outnumber males, and the reason being is because females have a shorter urethra than males. So because they have a shorter urethra, the bacteria don't have as much distance to climb to get to the bladder. And females outnumber males 4-1. And urinary tract infections are so common that it is estimated that 40 to 60% of females will develop a UTI at some point in their lives. And in patients who do get urinary tract infections, it's most common or most often to affect women between the ages of 16 and 35 years of age. Let's talk about the causes and risk factors of a UTI. So the causes are what we call the Keeps organisms. These are the bacteria that cause a UTI. Keeps is a mnemonic we can use to help remember the bacteria that cause a UTI. And these organisms include Klebsiella, E. coli, Enterococcus, Proteus, Pseudomonas, and Serratia. So a lot of these are gram-negative rods. So Klebsiella, E. coli, they come from the gastrointestinal tract. So they are large intestinal bacteria or colonic organisms. And the majority of cases are going to be caused by E. coli. And some patient populations are more at risk for having a UTI caused by specific bacteria. Patients in hospital are more likely to have UTIs caused by Pseudomonas, for instance. And then there's some atypical infective causes. So those are the most common causes, those Keeps organisms. There are atypical infective causes, and these include tuberculosis, Ureaplasma urealyticum, Chlamydia trachomatis, and even fungi like Candida albicans. So again, they climb up the urethra, they can reach the bladder, infecting the bladder, causing cystitis, and then they can even climb up and infect the kidneys, causing pyelonephritis. And they have particular mechanisms as to how they enter and how they can climb. They have villi and other ways to adhere to the urinary tract structures. Now, there are particular risk factors that can increase the risk for getting UTI, and these include being of the female gender. We mentioned this before. Females outnumber males 4-1, and this is because they have a shorter urethra. Being sexually active. Urinary stasis is also another risk factor, so not urinating a lot or infrequently. This gives time for bacteria to climb up the urethra, so they can get into the bladder and infect the bladder. If you're urinating frequently, then you're essentially trying to wash out those organisms, so they don't have time to climb up the urethra and get to the bladder. Urinary obstruction due to similar reasons. So if the urethra is blocked, if you're not able to actually urinate properly, organisms can climb, get around that obstruction, and get into the bladder and cause an infection. Catheterization. So catheterization can increase the risk for getting UTI. This is because bacteria can adhere and climb the plastic of the catheter and get into the bladder that way. And then certain medical conditions can increase the risk for UTI. Medical conditions that increase the risk of getting infections in general. So these can include diabetes, other immunocompromised states as well. And then pregnancy can also increase the risk for getting UTI. And this is mostly due to hormonal changes during pregnancy that can lead to urinary stasis. Now let's talk about the clinical features of a UTI. So we mentioned this before, UTIs may be asymptomatic. So we would call that asymptomatic bacteriuria. But in a UTI, we're going to have the following symptoms. Urgency, so a feeling or an urge to go to the washroom very quickly. So you need to urinate very quickly. Frequency, so an increased frequency of urination, even smaller urine volume. So even if a patient doesn't have much in their bladder, they still may feel they have to go to the washroom more frequently. And dysuria. And dysuria is the pain or burning sensation when urinating. These are the three classic symptoms of a UTI. We can also see suprapubic pain. So suprapubic pain would be in the pelvis or in the pubic area. There may be pain in that area due to irritation of the bladder. There can be some smelly urine. This can be due to bacteria in the urine or pus in the urine. There can be hematuria, which is blood in the urine. So those can be some features of a UTI as well. Urgency, frequency, and dysuria are going to be the classic symptoms though. And then there can be some complications of a UTI. We mentioned some of these before. One of them is pyelonephritis. This is due to an ascending urinary tract infection. You can get pyelonephritis through hematogenous spread as well, but most often pyelonephritis is going to be caused by an ascending urinary tract infection. So those bacteria climb up the ureters, eventually getting to the kidney and infecting the kidney. And again, we mentioned this ascending urinary tract infection. And with pyelonephritis, there's going to be flank pain. So flank pain is back pain that is located toward one side at the bottom or at the lower edge of where your rib cage would end. So it's not in the hip, it's where your rib cage ends. So that would be flank pain that occurs in pyelonephritis. And then costal-vertebral angle or CVA tenderness is a key clinical finding as well. If a clinician were to tap with their fist on this area here, the patient is going to jump and experience pain. So that would be CVA tenderness. And then a patient, because they have an infected organ, they're going to have fever and chills. So these are the most common findings in pyelonephritis. And because pyelonephritis patients are often very ill, they're also going to experience nausea and vomiting. So these are the signs and symptoms of pyelonephritis. And because this is often due to an ascending urinary tract infection, patients with pyelonephritis often have those other signs and symptoms of a UTI like urgency, frequency, and dysuria. Now, how are UTIs diagnosed? It is a combination of clinical findings, so history and physical examination findings, and laboratory findings. So symptoms, along with evidence of pyuria, so pus or white blood cells in the urine, and bacteriuria, or bacteria in the urine. So the way these laboratory findings can be found is through urinalysis. So with regards to finding white blood cells in the urine, that would be leukocyte esterase findings. So leukocyte esterase positive would mean that there are white blood cells in the urine. Nitrites are a sign of bacterial infections. So certain bacteria will produce nitrites. And then when looked at under a microscope, a urinalysis will show greater than 10 white blood cells per high-powered field. And then urine cultures may also be performed as well to get sensitivities, but this is often not performed. So urinalysis is the go-to. So that is how clinicians diagnose a UTI. Now again, if we find bacteria in the urine, that is bacteriuria, but if there are no symptoms, that is asymptomatic bacteriuria. Now, I didn't mention this before, but there are two types of UTI. There's a complicated UTI, and what I mean by complicated is there's a presence of any of the following patient characteristics. So if a patient has any of these characteristics, we automatically label this a complicated UTI. And the reason why I bring this up, complicated and uncomplicated UTIs, is because it's going to change how UTIs are treated. So if there's a presence of any of the following, including diabetes, immunocompromise, if the patient is pregnant, if there has been any urologic procedures, if there's any plastic, which means a catheter, and then if it is male gender, then any of these characteristics, it's going to be labeled a complicated UTI. So that's very important. And an uncomplicated UTI is no patient characteristics. So it's essentially a non-pregnant female. That is essentially what an uncomplicated UTI is. So again, very important to categorize complicated and uncomplicated UTI because it's going to determine how a UTI is treated. So how are UTIs treated? How do clinicians treat a UTI? If it is asymptomatic bacteriuria, it is not treated. Again, we mentioned this before, with the exception during pregnancy or during urologic procedures. And in the case of pregnancy, amoxicillin or nitrofurantoin are antibiotics of choice. So for uncomplicated UTIs, clinicians will treat an uncomplicated UTI oftentimes with a shorter duration of antibiotics. So sometimes it may be noted 3 days of antibiotics, but it really depends on what antibiotic is used. One of the options of antibiotic that can be used for an uncomplicated UTI is nitrofurantoin. So nitrofurantoin is one choice of antibiotic that can be used, but it should not be used in elderly patients due to issues with renal clearance. Another antibiotic that can be used in uncomplicated UTIs is trimethoprim sulfamethoxazole or Septra. Another one is fosfomycin. So those are some options of antibiotics for an uncomplicated UTI. Now, with regards to complicated UTIs and pyelonephritis, the same antibiotics can be used for complicated UTI, but for longer duration. So oftentimes 7 days is noted. Now, some other antibiotics can also be used. Ciprofloxacin may be used for complicated UTI, although it is mostly used for pyelonephritis. It's avoided with complicated UTI because it can breed fluoroquinolone resistance. And then with regards to pyelonephritis, IV ceftriaxone can be used to treat pyelonephritis. So again, in complicated UTI and pyelonephritis, it takes a little longer duration of antibiotics. And then there's a couple other options, but mostly these are going to be used for pyelonephritis, ciprofloxacin and IV ceftriaxone. So if you want to learn more about infectious diseases, please check my infectious disease playlist. And if you haven't already, please like and subscribe for more lessons like this one. Thanks so much for watching, and I hope to see you next time.